Good afternoon. Thank you so much for joining us for our announcement. We have titled this announcement a bit provocatively, Where Did I Put My HSA Card? And we're focusing on this because this is a big problem. Patient balances are higher than ever. In fact, if you look here, you'll see about $500 billion is spent by patients annually in the healthcare system. And it has been growing at a huge clip. It's partly because high deductible plans have been consistently the fastest growing health plan in the country. Over a third of Americans are on a high deductible plan. So the fact that patients are now responsible for the cost of their care is a relatively new thing. And the idea was that these health benefit accounts were meant to help, right? You get to put money away into a tax advantaged place, and you could use that to help absorb some of the costs of the care. But the reality is it hasn't worked as well as we have hoped. People don't really understand what a health savings account is or what a health benefit account is. They don't really know how to use it. We interviewed about a couple thousand consumers with The Economist and found a third don't know what they are. 35% have forgotten that they even have the account in the first place. Almost a third do not know how to pay a medical bill with these accounts. And over a third have been just put off using it altogether because it's just too difficult. And I don't know if anyone here has one of these accounts, but maybe you can relate to this experience. What ends up happening as a result is that a lot of this money goes to waste or just not used well. So FSAs, for those of you who know what a flexible spending account is, this money goes away at the end of the year if you don't use it. And so $3 billion annually is just lost, just eliminated from consumer accounts because people don't remember to use it. There's $150 billion sitting in health savings accounts in this country currently. And one could say, well, maybe that's a good thing, right? Because those are investment vehicles and people can be using that to kind of grow their wealth. Well, the problem is that less than 10% of those funds are actually invested. They just sit in checking accounts. So these funds are not used well. And we at Cedar have been really excited to figure out ways that we can help unlock those dollars for the benefit of consumers, right? Cedar is in the financial billing space, right? We serve 30 million patients annually. We handle medical bills on behalf of large hospitals, medical groups. In many ways, we are the entity that is helping patients manage really expensive medical bills. And so as we think about our role in this, we realize how critical it is to make it easy for patients to access the resources that they have available to them. And so you're seeing here, as I'm talking, flashing to the right, a little demo where we're showing a hospital bill that you might get from one of our clients. So we work with Allegheny Health today. And if you're a patient of Allegheny and you happen to have a health benefit account balance with, let's say, Allegis or another HSA bank, we will show it there, right in that workflow. So at the moment you're thinking of spending on a big bill, you can see that you have a balance available. We make it easy for you to pay. With just one click, you can see that balance. So instead of needing to navigate various different websites to get to this information, we're bringing it to your fingertips. So we're super excited to be rolling this out. We're working now with a number of the largest HSA banks. We're excited that this is also a part of a broader strategy to incorporate network partners as we work with hospitals. So this is one example where by connecting HSA accounts, by working with insurance companies, we're able to create a far better and superior billing experience. So with our customer Highmark and Allegheny Health, by bringing all this information together in one place for patients, we've been able to unlock some really amazing benefits. So Allegheny has seen a $17 million increase in net income as a result of our work. And they've done so by seeing huge lifts in engagement. So over a third higher utilization of HSA accounts, right? That's really powerful. 90% of patients are saying they're satisfied with the experience, and we're seeing a material drop in call center requests, right? People call in when they don't understand their bills. So we're really thrilled to see the validation of this network approach. And for us, it's part of a bigger model around being connected, right? At Cedar, we firmly believe that hospitals and providers cannot solve the billing problem on their own. It requires connection with ecosystem partners because we know that consumers need to navigate multiple sites today, and we're doing our best to bring it together. So we're super proud to now be at a place where we serve 30 million patients a year across 55 clients. We process $10 million in payments every day. And we're super excited to bring this HSA ecosystem to bear for them. So thank you. Appreciate it. And thank you for joining our exciting announcement.